Good morning, students.
Good morning, ma'am.
Good
Okay,
evening.
good morning. So let's
Good
start our
morning, ma'am.
good morning. So before moving to next topic, let's do a quick revision of our last class. What we have seen yesterday?
Pain and pulse oximeter.
Okay, pain and pulse oximetry. Okay. What is the normal range of pulse oximetry?
95 to 100.
95 to 100.
95 to 100. So we have seen the description of pulse oximetry, nursing considerations. What are the reasons due to which the SpO2 value can be altered? What are the reasons in which the SpO2 value will become less? So we have seen all these nursing considerations. Okay, then procedure. How do you take the SpO2 that we have seen? How you will take the SpO2? Tell me.
More pulsating area, we have to put the probe and
Yes.
take.
Yes, we have to take the SpO2 at the very highly vascular area where the blood circulation is very high. So that is fingertip, toe, nose, earlobe, or forehead. Then what is the main thing that you have to remember? You cannot apply the probe at cold extremities because due to cold weather, the blood circulation will be altered. In cold, due to cold, what will the arteries, what happens with the arteries? Due to cold weather or cold temperature, the arteries will get
Constrict.
constricted, yes, and the blood flow will become altered. What is the red important point that you have to remember? What was that important point?
If SpO2 90% less than, then inform to HCP.
Okay.
And
What
some conditions,
okay.
90% is acceptable.
Less than 90% is acceptable. In some chronic conditions like COPD, acute asthma. So in those patients, SpO2 does not get so high. So it is considerable that it is less than 90. So it's okay. There is no any problem. But if the SpO2 is between 90 to 95, what you will do?
Main position.
Yes, we will anyhow improve the breathing of patient through position or breathing techniques or any possible way. We will simply just check whether it goes to 95 or more or not. So we have to improve the breathing of patient. Okay, next vital sign, last vital sign, that is pain. First, we have completed types of pain. So how many types of pain are there?
5.
5.
Five pain. So what do you mean by chronic episodic pain?
It is chronic pain and some episodic cause.
Okay.
થોડા time માટે.
Yes. In some time of interval. A chronic છે, it is long lasting. It stays for years, but it occurs. The patient experiences pain in some intervals, that is some episodes. So that is chronic or episodic pain. What do you mean by acute transient pain?
Associated with injury or stay
Surgical
to a few days.
procedure.
Yes, it is due to any injury or surgical procedure or any invasive diagnostic procedures, and due to which the patient experiences pain for some days only. So that is called as acute pain. What is idiopathic pain?
Unknown.
Yes, the pain is chronic, but the cause is not identifiable. We don't know why the patient is experiencing pain. Patient does not have any illness or any problem. Patient does not has undergone any surgical procedure or invasive procedure. Still patient is having pain. We don't know the cause. That is called as idiopathic pain. What is chronic persistent non-cancer pain?
Patient will persist pain and it is long term pain.
Yes, it is a long-term continuous pain, but it is not related to cancer. It is not due to the cancer. Maybe any other illnesses and disorders. Due to that, the patient experiences pain for more than months or even years. So that is chronic pain. What is cancer pain? Yes, due to cancer, due to tumor overgrowth progression, due to invasive procedures and chemotherapy, radiation therapy. Yes, due to all these reasons, patient experiences pain. It may be acute or chronic, but it is due to cancer. The cause is cancer. That's why it is called as cancer pain. Understood the types of pain?
Yes, ma'am.
Yes, ma'am.
Then we have completed assessment. What, how you will assess the pain? Okay, by verbal and non-verbal both. If the patient is well oriented, conscious, and the patient is adult, so you can assess the pain through verbal method. If the patient is pediatric, semi-conscious or unconscious, or patient is not a cognitive patient is not a completely cognitive abilities, so you have to assess with normal verbal pain scales. So there are two methods, but what you will ask to the patient if you are doing verbal assessment of pain?
Describe in terms of timing, location, severity, quality, aggress- gravity, factors, and relief measures.
Okay, so you will ask the patient about timings, at what time you are experiencing pain, location, at what site you are experiencing pain, severity in terms of,
Moderate, mild.
yes, mild, moderate, severe. Quality, you will ask about quality. What is that? Mild, moderate, severe.
No. Type of pain?
Pain, yes. Is the patient pain is aching, throbbing, pulsating, cramping? What type of pain you are experiencing? Aggravating means
Vijay.
One to जाए.
pain is there, but due to this reason, see this specific cause, the pain is increasing. That is called as aggravating factor. What is precipitating factors?
Due to some reason, pain is increased.
No, pain
This
increases called
है.
as aggravating.
नहीं, due to some reason pain feels high.
Yes, the patient experiences pain due to any cause or reason that is called as precipitating factors. Before that, the patient was not experiencing pain, but due to this reason, patient has initiated pain. So that is called as precipitating factors and relief measures. Then what you will ask, what you will suggest to the patient? First, always you will go with the
Non-pharmacology.
non-pharmacological method. So that is complementary or alternative therapies. Then what you will keep in mind doing while doing assessment?
Land
Older,
culture, spiritual beliefs.
yes, that is so important. You have to always keep in mind about patient's culture, spiritual and religious belief, because in some cultures they express pain very loudly, and in some cultures they do not express pain. So you have to always keep in mind this point. Then about older clients. Yes. Yes, the older clients will express pain in different way as compared to adults due to many reasons like sleep disturbances, change in gait and mobility. And what about cognitive disabled client?
Express नहीं करी सके pain.
Yes, they cannot express their pain because they are not cognitive healthy. They are not healthy in cognitive terms, so they will not express their pain. So what you will do in such patients?
Non-verbally.
Yes, we will assess the non-verbal signs, indicators of the pain. So, what are the non-verbal indicators of pain?
Cry, irritable, restlessness,
Yes,
reduced
Yes, moaning, crying, irritability, restlessness, grimacing or frowning, inability to sleep, rigid posture, hypertension, tachycardia, tachypnea, nausea, diaphoresis. And there are more scales to assess the pain non-verbally, like FLACC scale. It is specifically used for pediatric client. And next is FACES pain scale. We can use this pain scale for all the clients, even the client is older, adult, or pediatric. You can use the FACES pain scale. So there are four types of pain scale. First is numerical.
Wrinkle.
Yes. First is numerical pain scale. In that, there are numbers 0 to 10. So according to that, you have to ask patient, tell me from 0 to 10, how much pain you are experiencing. So patient will tell you that this much amount of pain I am experiencing. Next is descriptive type of pain. No pain, mild, moderate, severe, and unbearable pain. Visual analog pain, you have to just simply, there is one line, you have to ask the patient to describe their pain in between these two lines. And last is pain scale. By seeing the patient's facial expression, you have to identify that what is the score, 0, in between 0 to 10. Okay, so any doubt till this?
No, ma'am.
Okay, so let's start with the management of pain. Till now we have completed description of pain, assessment of pain, and then we have to give the treatment. We have to manage that pain. So initially, how you will manage?
Non-pharmacological.
Pharmacological method. Yes. So there are certain non-pharmacological interventions, conventional non-pharmacological interventions. Conventional means it is used in wide range. It is very convenient. Conventional for non-pharmacological methods. So first is cutaneous stimulation. What does the name suggest? Cutaneous. What is cutaneous related to?
Skin.
Skin. Yes, you have to stimulate the skin. So techniques include heat, cold, pressure, and vibration. Therapeutic touch and massage are also cutaneous stimulation and may be considered as complementary alternative techniques. Such treatments may require a PHCP's prescription. Cutaneous stimulation, that means you have to stimulate the skin of the patient through which the pain get relief. Like you can apply heat, cold, pressure, that is called as acupressure. Then vibration, there are certain machines like TENS machine, through that we can give the vibrations. Then therapeutic touch and massage can also be used to relieve the pain of patient. So all these methods are considered as complementary and alternative techniques. Such treatments require PHCP's prescriptions. You cannot directly apply heat to the patient. If PHCP will give you order, give heat application to the patient, then and then you have to give the heat application or cold application or any vibration machine. So such treatments will require PHCP's prescription. Without prescription, you cannot directly give the treatment to the patient. Second method is transcutaneous electrical nerve stimulation, that is TENS. Have you heard about this device earlier?
No.
क्या Okay, physiotherapists use this TENS machine. They will tell you that I have given TENS to you. I will give you TENS. Any friend of yours who is in physiotherapy? કોઈને ખ્યાલ હોય જેનું ફ્રેન્ડ ફિઝિયોથેરાપીમાં હશે એમને આ વર્ડ સાંભળ્યો હશે. એ લોકો ટેન્સ મશીન વધારે આપે.
બે સ્ટ્રીપ જેવું હોય છે જે આપડા બેકમાં લગાવવા
હા,
અને
યસ.
પછી સ્ટાર્ટ કરે.
એન્ડ
ફિઝિયોથેરાપીમાં જઈએ ને ત્યાં કરતા હોય છે કે જે પેન નું સેન્સેશન હોય આપણને ઓછું થઈ જાય
યસ
અને મસલ્સ
અને
રિલેક્સ થાય,
અને એ સ્ટ્રીપ્સ લગાવવાથી એમાંથી શું થાય છે?
કરંટ આવે આમ.
Yes. So the name suggests electrical nerve stimulation. So there is one device. Through that device, electric current is transmitted into the body, and that is so minor, which relieves your pain. So TENS is also referred as percutaneous electrical nerve stimulation. So that is TENS. Transcutaneous is converted into percutaneous. So both names are correct, TENS or PENS. This technique which may require a PSCP's prescription, involves the application of battery operated device that delivers a low electrical current to the skin and underlying tissues to block the pain. Some similar units can be purchased without prescriptions. Okay, so there is one device which is operated through the battery. There are some cells, battery operated device, and the patches are sticked to the place where you are experiencing pain. Through that device, minor electric current will be passed through your skin and the pain gets relieved. There are some small devices through which the patient can take TENS at home also. So that devices does not require any prescription. The patient can purchase those devices from market without prescription. Understood about TENS?
Yes, ma'am.
Okay. Third is binders, slings, and other supportive devices. Let me give you one example. Whenever a person is experiencing pain, doctor suggests to wrap the crab bandages. Have you seen the crab bandages? Pink
Yes.
color bandages? Yes. So they are called as binders, slings, or other supportive devices due to which you can eliminate your pain. That is a non-pharmacological methods. Clothes or other material or devices are wrapped around a limb or a body part that can ease the pain of strains, sprains, and surgical incisions. They are wrapped around the limb whichever the location the patient is experiencing pain. Doctor will suggest to wrap a cloth, that is the crab bandage or other devices wherever the patient is experiencing pain. For example, if patient has undergone TCAR, so there are special devices that will support the knee to relieve the pain. And one example is crab bandages. Whenever a patient has experienced strain or sprain, so the doctor will suggest to wrap the crab bandages. Some devices may require PSCP's prescription. Yes, we know that PSCP's prescription will be required. What to wrap around your limb? If the crab bandage can help, so doctor will prescribe you crab bandage. If other devices will need, the doctor will prescribe you other devices. Elevation of the affected body part is another intervention that can reduce the swelling. Supporting an extremity on a pillow may lessen the discomfort. Supportive devices like we can advise the patient to elevate that affected limb in which the patient has any injury or pain, patient is experiencing any pain. So by elevating that limb, the swelling will get reduced because the blood flow will move towards the heart and the limb is already elevated, so the swelling will get reduced and the pain will become reduced, the pain get reduced. So that is another method to reduce the discomfort. Okay, last is heat and cold. We know heat and cold comes under which technique?
Cutaneous stimulation.
Yes, cutaneous stimulation. So heat and cold application is also a part through which we can reduce the pain. The application of heat and cold or alternating application of two can soothe pain resulting from muscle strain. Cold reduces swelling. Yes, we know by applying heat or cold, or we can apply alternatively, or we can apply both. So to reduce the pain. In some conditions, such treatments require PHCPs prescription. Not every condition, but there are something specific conditions like patient has some injury or anything like that. So in that conditions, you will require PHCP's prescription before applying heat or cold to the patient. If it is minor, then you can directly apply heat or cold without PHCP's prescription. But in some specific conditions, you will require PHCP's prescription. Heat application may include warm water compress, warm blankets, thermal pad, and tub and whirlpool bath. How you will apply warm heat application to the patient in form of warm water compresses. There are hot water bags. Did you know about hot water bags? Yes,
Yes.
Yeah.
there is one bag in that we will pour the hot water and that hot water bag is applied to the skin. So there are warm water compress, warm blankets, thermal pad. What is thermal pad? thermal pad means? They does not contain any hot water or anything. They are simply just hot thermal pads. If you will apply to the patient, it will transfer the heat to the skin. So this is called as thermal pads. They do not contain any water or anything. Then tub or whirlpool bath. You will provide a tub bath, hot water tub bath. For example, a patient has undergone hemorrhoid surgery, hemorrhoidectomy. If the patient has undergone hemorrhoidectomy, so you will provide seeds bath. What is that seeds bath?
હોટ વોટર જ હોય છે ને એમાં ને પછી આપણે સીટ્સ પ્રોવાઈડ કરીએ છીએ.
Yes, it is simply a hot water tub bath in which you are adding some antiseptic solution because the patient has undergone surgery. So to prevent the infection, you are simply just adding some antiseptic solution. And that hot water bath will relieve the pain of hemorrhoids. Hemorrhoidectomy, the hot water bath will relieve the pain of hemorrhoidectomy. So that is the best thing. It is simply hot application to the patient. So we can give tub bath, whirlpool bath, that is warm water, tub bath and whirlpool bath. Next, the temperature of the application must be monitored carefully to prevent the burns. The skin of very young and older client is extra sensitive to heat. Yes, before applying any hot application to the patient, you have to check the temperature first. Because if you will not check the temperature, the patient will get
burns.
burns. Yes. To prevent the burns, you have to check the temperature first. What is the next point? The skin of a very young child. That is the infant or pediatric client and very older client. Their skin is so sensitive to heat, they will get burns very easily. So you have to always monitor the temperature before applying the heat application. The client should be advised to remove the source of heat or cold if changes in the sensation or discomfort occurs. We have to advise the patient that whenever you are applying heat application or cold application, you have to once you feel discomfort or any changes in the sensation, you have to simply remove that applicator. You have to remove that heat application or cold application. If the change in sensation or discomfort is not relieved after removal of application, the PHCP should be notified. If we are advising the patient that whenever you feel discomfort, you have to remove just applicator, you have to just simply remove it. But still, after removing, the patient's discomfort is not relieved. So, and now you have to notify the PHCP that patient is feeling discomfort still after removing the applicator. What is the important red point that you have to remember is ice or heat should be applied with a towel or other barrier between the pack and the skin, but should not be left in place for more than 15 to 30 minutes. What does this says? What does this red point tells you?
જ્યારે બી તમે આઈસ અથવા હીટ એપ્લાય કરો ત્યારે વચ્ચે બેરિયર રાખવાનું ટોવેલ કે
Yes.
અધર અને જો
Yes.
વધારે 15 થી 20 મિનિટ સુધી નહીં રાખવાનું.
Yes, you cannot directly apply heat or cold application to the skin. You have to always keep a barrier. Can you apply directly ice pack to the area of the pain? No.
નો
No, we will always require one barrier like towel, handkerchief, any cloth should be a barrier between the applicator and the skin, between the pack and the skin. We cannot directly apply that applicator to the skin. And make sure you will not place the heat or cold applicator for more than 15 to 30 minutes. After 30 minutes, you have to tell the patient, now remove your applicator. After some time, after half an hour, after 1 hour, you can again place the heat applicator or cold applicator, but it should be placed left in place only for 15 to 30 minutes, no more than that. Understood?
Yes, ma'am.
Okay, so you have to remember this point. Next is complementary and alternative therapies, other therapies which are not conventional therapy. Like this is not considered as a medical or research scientifically proven. It is assumed that this can relieve the pain, but there is no scientific clue that it is surely relieving the pain. So these therapies are called as complementary and alternative therapies. Understood the difference?
Yes.
Okay. So what is complementary and alternative therapies? The therapies are used in addition to conventional treatment to provide healing resources and focus on mind-body connection. Whenever you are using conventional treatment methods, we have seen cutaneous stimulation, TENS, share, heat and cold applications, share, all these methods you are using. Along with that, you are adding some complementary and alternative therapies which helps to eliminate the pain, because this complementary and alternative therapies work on mind body connection. It's like whenever patient we are providing acupuncture, the patient will think, yes, I am now relieving from the pain. So this is directly related to mind and body. Whatever the patient thinks, the patient will experience the same. So that is called as complementary alternative therapy. So what are the types of complementary alternative therapy? Let's see the box 10.5. First is acupuncture and acupressure. Do you know about acupuncture and acupressure?
Yes.
Okay, so first is acupressure and acupuncture. Next is biofeedback. What is that biofeedback?
આપણી બોડી જાતે જ આમ હીલ કરવા માટેનો ટ્રાય કરીએ ને આમ.
Okay, but little bit more information. How?
ડાયવર્ટ કરીએ માઇન્ડને.
Somewhat. Any other guesses? It is directly related to mind and body. So you are correct. We are diverting the patient, but through
ઇમેજિનેશન એક્શન
that
મ્યુઝિક
is another therapy.
થેરાપી.
That is another therapy. Imagination is another therapy. Simply biofeedback means you are telling the patient, like, for example,
deep
uh,
breathing exercise.
there is another technique. Okay, let me give you, let me uh, uh, Jayanti, can you understand Hindi?
Yes, ma'am.
ओके हाँ सो एक पेशेंट है आपके पास और उसको कुछ प्रॉब्लम हो रहा है, उसको कुछ पेन हो रहा है. फॉर एग्जांपल सोमैटिक पेन, व्हाट इज दैट?
Body pain means physical.
यस, यस, बट ड्यू टू the cause of somatic pain is due to
મેન્ટલી
yes, something mental disorder. For example, pain due to stress, pain due to depression. So that are called as somatic pain. That the cause is something mental disorder. So patient आपके पास एक patient है जिसको problem हो रहा है. So आप patient को ऐसे biofeedback देते हो कि think about this. You are not having pain, you are healing from the pain. So through the feedback, the mind and body gets connected and the pain gets relieved. Understood what is biofeedback? You are ordering the patient to accept that now you are not feeling any pain. You have to just simply accept that I'm not feeling any pain. So that is called as biofeedback method. The mind and body directly connects in this biofeedback method and the pain gets relieved. Patient will not experience pain because patient has already accepted that now he is not feeling pain. So this is called as biofeedback method. Next is chiropractic manipulation. What is that? Chiropractic? Any idea? Guesses?
બોડીને આમ ખેંચી તોડીને કરે.
Okay. Simply, yes, simply we can say that popping therapy. It is also called as popping therapy. The therapist, it cannot be done by anyone. There must be a specific therapist who is mastered in chiropractic manipulation. So the therapist will pop up the joints. वो बोलते हैं ना कि वो आपके जॉइंट्स को ऐसे पॉप करते हैं और उससे वो रिलैक्स हो जाता है पर्सन. सो दैट इज काइरोप्रैक्टिक मैनिपुलेशन. Then distraction techniques. You have to simply distract the patient from the pain. So that is distraction techniques. Guided imagery and meditation techniques. Guided imagery means you have to ask the patient to imagine something different other than pain. So that is guided imagery, meditation techniques, that is deep breathing techniques, and all comes under meditation techniques. You have to simply meditate the patient. You have to tell the patient that do meditation, which helps to reduce the pain. Then herbal therapies. There are certain herbal therapies. We have seen in medication pharmacology that a patient is taking some herbal therapies to relieve the pain. So we will see what are the herbal therapies. Then hypnosis. What is that hypnosis? Hypnosis.
करे
Yes, we just simply hypnotize the patient, and we will tell that you are not having any pain. Tell me. So that is simply hypnosis. Laughter and humor. Laughter therapy is the best therapy. So laughter therapy and humor therapy, art therapy, music therapy, massage. Next, relaxation, breathing, and repositioning techniques. Spiritual measures, for example, prayers. Sometimes prayers also helps the patient to reduce the pain. This is not scientifically proven. That's why it is called as complementary or alternative therapy. But it is believed that this can reduce the pain. So that's why it comes under complementary and alternative therapy. So prayers, use of rosary or prayer beads. What is rosary? What is rosary? Christian students, those who are following Christianity, they will understand what is rosary. No one?
વન ટાઈપ ઓફ ચેન હોય એમાં હિન્દુમાં પેલું માળા ને એવું કરે ને
Yes.
એવી રીતે.
Huh. The Christians will tell that Rosar, એવું something કહેશે.
યસ
Rosary.
રોસારી.
Okay, હા, રોસી રોસાડ એવું બોલાવવામાં આવે છે. So that is rosary. The Christians will use rosary. Then prayer beads. જે બીજા રિલિજન વાળા છે, for example, Hindus માળા ફેરવે છે. So these are the methods through which the patient's pain get reduced. Reading of scripture. If someone is reading some scripture books, then pain will also get reduced. Therapeutic touch, like massage or anything. So that all comes under the complementary and alternative therapies. Understood about the types of complementary and alternative therapies?
Yes, ma'am.
Okay. So let's move to the next topic, that is nursing consideration. While giving the complementary and alternative therapies, in examination, they will ask you CAM therapy. CAM therapy means
Complementary or alternative therapy.
measures. Yes, complementary and alternative measures or therapy. So they will ask you about CAM. So you have to understand CAM stands for complementary and alternative measures or therapies. Okay. Nursing consideration. Some complementary and alternative therapies requires PSCP's prescription, like chiropractic manipulation cannot be done without PSCP's prescription. So some techniques will require PSCP's prescription, like hypnosis, herbal therapies, chiropractic manipulation. There are some examples. Herbal remedies are considered pharmacological therapy by some PSCP because of the risk of interaction with prescription medication. It is important that the nurse asks the client about the use of such therapies. We know herbal therapies are considered as a pharmacological therapies. Why? Why herbal therapies are considered as pharmacological therapy? We have already completed this in pharmacology. Because there are chances of drug
Oh,
interaction. Yes, some herbal therapies will interact with some specific medications and will cause interaction to the patient, side effects to the patient. So every time whenever you are doing physical assessment of a patient, you have to always ask about herbal therapies. The patient, if the patient is taking herbal therapies, which type of herbal therapies the patient is taking, you have to ask such questions to the client. Understood?
yes.
Understood or not? Yes. Next, if the cultural or spiritual measures are to be employed, the nurse must elicit from the client the preferred form of spiritual expression and learn when they are practiced so they can may be integrated into the plan of care. Yes, you have to always consider the patient's cultural and spiritual measures while giving care. For example, if the person is Christian and you will tell the patient to use the prayer beads, will it helpful to the patient? No. In his religion or in his culture, it is not accepted. So you have to always keep in mind about the patient's cultural, spiritual, and religious belief. And according to them, according to that practice, you have to advise the patient about their practices, their spiritual measures, and you can use that spiritual measures as a plan of care. You can help the patient by using all these methods to relieve their pain. So before advising the spiritual measures, you must have the idea regarding their spiritual practices, their spiritual measures. So you have to always keep in mind about their spiritual measures. Next, this is herbal remedies. So there are some herbal remedies you have to remember because in examination they will ask you about herbal remedies. This is something important. So you have to always remember this. So first herbal medication is ginkgo biloba. Ginkgo biloba, what it is used for? The patient will use if the patient is experiencing something memory deterioration or any problem with the memory. So it is used for memory enhancement. And what are the side effects of this biloba? What is the side effect of this herbal remedy?
Bleeding.
Bleeding.
Bleeding. Yes, there are certain bleeding risks. For example, if patient is taking ginkgo biloba, so can you give warfarin or heparin to this patient?
No.
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 Because this herbal medicine can already increases the risk of bleeding, and while giving heparin or warfarin this risk will increase more, so you have to always keep in mind. Next herbal remedy is ginseng. It is used for mental performance. It will increase the mental performance, but again the side effect is bleeding risk. Next is saw palmetto. Saw palmetto is used for BPH, and the side effect is not the bleeding risk, but actually it is related to GI stomach discomfort. It is not directly linked with the bleeding risk. ऑलवेज रिमेम्बर जो भी हर्बल रेमेडीज जी से स्टार्ट होती है उसका साइड इफेक्ट ब्लीडिंग रिस्क होता है, ये पॉइंट याद रखना है. फॉर एग्जांपल इन एग्जामिनेशन यू हैव आस्क्ड समथिंग अबाउट हर्बल रेमेडीज एंड इफ स्टार्ट्स विद द लेटर जी, सो व्हाट इज दिस साइड इफेक्ट? जी से स्टार्ट होती हुई हर कोई भी हर्बल रेमेडीज हो उसका साइड इफेक्ट क्या होगा?
Bleeding.
Bleeding.
Yes.
Bleeding risk. This is the shortcut key that you have to remember because it is not possible that you can remember all the herbal remedies and their side effect and their use. So there is one simple trick: the herbal medicine which starts with letter G. The side effect of that specific herbal medicine is the bleeding risk. So you have to always keep in this mind. Next is St. John's wort. St. John's wort is given for depression and insomnia. The client who is suffering from depression or insomnia, the client will take St. John's wort. What are the side effects of these herbal medicines? So there is hypertension, decreases the effect of anticoagulants, interact with antidepressants, steroids and digoxin. So you have to always keep this in mind. If the patient is taking St. George's wort, the patient is risk for hypertension. It decreases the effect of anticoagulants. So again, you cannot give anticoagulants like warfarin or heparin to the patient because these herbal remedies will not make it effective. The anticoagulants will become less effective. Interacts with other antidepressant medication. If the patient is suffering from depression, patient is already taking herbal medicines and you are giving antidepressant medications. So it will interact with antidepressant medications. It will also interact with steroids and digoxin. Next is licorice extract. licorice extract is used for ulcers and bronchitis. If the patient is suffering from ulcers and bronchitis, they will use licorice extract. What are the side effects of this herbal medication? That is hypertension, hypokalemia. What is hypokalemia? New student, Jayanti and Megha, what is hypokalemia?
Low potassium.
Low potassium, yes. Increased risk of digoxin toxicity. Do you know about digoxin medication? Any idea about digoxin?
It is used for cardiac patients.
Yes, it is specifically used for the patient who is suffering from the cardiac failure. So digoxin medication is prescribed to the cardiac patient. If the patient is taking the licorice extract, there are risk of digoxin toxicity. So these are some herbal remedies that you have to remember. When I was a student, I have taken this picture from U World. In U World, there are more herbal remedies, but you have to remember these herbal medications. I am telling you, you cannot take screenshot from the U World. आप जब यू वर्ल्ड प्रैक्टिस करो आप उसमें से स्क्रीनशॉट नहीं ले सकते बट यू कैन सिंपली टेक picture. You can use the camera from the screen. You cannot take the screenshot, but आपके फोन से आप कैमरे से फोटो ले सकते हो. और this is the list. Whenever you will solve the U world, you will get the list. जब आप U world solve करोगे तो आपको वहां पर ये list मिल जाएगा herbal remedies का. At that time, you have to take the picture of this herbal remedies and you have to remember these herbal remedies. When I was student, मैंने इतनी herbal remedies याद करके रखी थी बट इन एग्जामिनेशन आई वाज आस्क्ड something new herbal remedy which I don't know I was right or wrong but I have given my best. So you have to remember these herbal remedies. Understood? So
Yes,
right
ma'am.
now if you want to take screenshot you can take the screenshot but you will find this table in uworld. I have taken this picture from uworld itself. Okay, so let's move to next topic. Okay, so till now we have completed non-pharmacological interventions, that is conventional therapy, then complementary and alternative therapy. Last is pharmacological interventions. So how you will manage pain through pharmacological interventions? Just a minute. Okay, so what are the pharmacological interventions? How you will relieve the pain of patient through medications? We have already,
एनाल्जेसिक आप
yes. What are the analgesics? क्या है analgesics आपसो?
एसिटामिनोफेन
Acetaminophen.
Okay, acetaminophen. What is that? New
PC.
student? What is acetaminophen?
Sorry, ma'am.
Okay. Acetaminophen is simply paracetamol. In NCLEX country, they do not use word paracetamol. Instead, they use acetaminophen word. Okay. Other analgesics that you can use?
डाइक्लोफेनिक
Okay. Diclofenac comes under?
एनएसआईडी
Yes, NSAIDs. So the classification is NSAIDs, non-steroidal anti-inflammatory drug. Okay, so let's start with non-opioid. There are two types of medications, non-opioid and
Opioids.
opioid. Okay, opioids are higher dose analgesics. Before moving to opioids, first we will give
No.
नॉन
non-opioid. What are the non-opioid drugs?
Like
Non-NSAIDs. Then
cyclooxygenase inhibitor.
yes, COX inhibitors. Yes, cyclooxygenase inhibitors and
And then acetaminophen જે ઇન્ફ્લામેટરી બી નથી ખાલી એન્ટીપાયરેટિક જ છે.
No. It is not only antipyretic. It works as a analgesic as well. Yes, it is not. Its effect is not only antipyretic. It works as an analgesics also. So these are the non-opioid analgesics. Next is opioid analgesics. So let's see first non-opioid analgesics. So in that, first is non-steroidal anti-inflammatory drugs and aspirin. Aspirin itself comes under non-steroidal anti-inflammatory drug. Aspirin works as the mechanism of action. Aspirin has two actions. What are that?
Antiplatelet.
પ્લેટલેટ
Yes. Antiplatelet effects and analgesics. Aspirin can relieve the pain also. So there are two mechanisms of aspirin. So let's see first side effects or adverse effects of NSAIDs and acetyl salicylic acid. What is acetyl salicylic acid? Itself aspirin. So the side effects of NSAIDs are gastric irritation, sodium and water retention, blood dyscrasias. What is blood dyscrasias? What do you mean by blood dyscrasias? No idea? We have already completed this in pharmacology.
કોઈ blood disorder હોય.
But what happens in blood dyscrasias? It is blood disorder.
આરબીસી ડબ્લ્યુબીસી બોન મેરોમાંથી બહુ ઓછા રિલીઝ થાય મતલબ
Yes, RBCs, WBCs, platelets, all types of blood cells will reduced. The production will get decreased from the bone marrow. So that is called as blood dyscrasias. Tinnitus. What is tinnitus?
ringing of the ear,
Ringing of the ear. Pruritus. Pruritus means
itching general
itching of the skin. So these are the side effects of NSAIDs. What is the side effect of aspirin? So gastric irritation, flushing, and tinnitus. What is flushing? New students, what is flushing? Jayanti and Megha, what do you mean by flushing? Um, Someone is trying to speak something, but you are not clearly audible.
આમ blood વધારે flow થાય એટલે skin આમ red થઈ જાય.
રેડ થઈ જાય સ્કિન
Yes.
રેડ માં.
Yes, increased blood circulation, fluid circulation. So that is called as flushing. And tinnitus, ringing in the ear. So these are the side effects of NSAIDs and acetyl salicylic acid. Let's move to the topic. These medication types are contraindicated if the client has gastric irritation or ulcer disease or an allergy to medications. Yes, we cannot give this medication if the client is already having some gastric irritations. Ulcer diseases like peptic ulcer disease. Yes. GERD is also gastric irritation disease. Peptic ulcer disease, duodenal ulcers. So in ulcer diseases, we cannot give NSAIDs and acetyl salicylic acid. Why?
કેમ કે એ બી ગેસ્ટ્રિક ઇરિટેશન કરાવે
Yes, and will increase the
બ્લીડિંગ
Flushing.
થઈ શકે.
bleeding risk. Yes, so we cannot give these medications to the patient who are experiencing gastric irritation or ulcer disease or allergy to NSAIDs or aspirin. Bleeding is the concern with the use of this medication type. Bleeding is the major concern. Why? हमने उसमें देखा था कॉक्स इनहिबिटर्स. अगर कॉक्स इनहिबिट हो जाएगा तो क्या होगा? एंजाइम इनहिबिट हो जाएगा तो रिलेटेड टू ब्लीडिंग क्या होगा?
રિસ્ક વધી જાય બ્લીડિંગ.
How? The platelets
પ્લેટલેટ ડિક્રીઝ
Like
થઈ જશે.
blood
ડિક્રીઝ થઈ જાય આમ.
reduces the platelets. So bleeding risk will get increased. We have completed all this in pharmacology. Instruct the client to take oral doses with milk or a snack to reduce the gastric irritation. We have to always advise the patient. Whenever the patient is taking NSAIDs or aspirin, we have to advise the patient to take the oral doses with milk or with some food, so to reduce the gastric irritation. NSAIDs can amplify the effects of anticoagulants. Yes, anticoagulants are again reduces the blood clotting, and NSAIDs are also reducing the delaying the blood clotting, so they can amplify the effect of anticoagulants. Whenever a patient is taking some anticoagulant and you are giving NSAIDs, so which risk will increase more?
Bleed.
Bleeding risk, yes. Hypoglycemia may result for the client taking ibuprofen if the client is concurrently taking an oral anti-diabetic agent. If the person is taking, if a diabetic person is taking oral hypoglycemic agents or oral anti-diabetic agents, and the person same time the person is taking ibuprofen, so the effect of oral hypoglycemic agents will amplify and patient will experience hypoglycemia, because ibuprofen है वो ओरल हाइपोग्लाइसेमिक एजेंट्स की इफेक्ट्स और बढ़ा देता है और क्लाइंट को हाइपोग्लाइसेमिया हो जाएगा. A risk of toxicity exists if the client is taking ibuprofen concurrently with the calcium channel blocker. अगर client ibuprofen ले रहा है, ibuprofen क्या है?
NSAIDs.
NSAIDs, yes, ibuprofen it's itself NSAIDs. अगर client ibuprofen NSAIDs ले रहा है और साथ में calcium channel blockers ले रहा है, what are the examples of CCB?
Nifedipine.
Yes, yes, DP is the example of CCBs. Calcium channel blockers कब लेगा client?
Hypertension.
In hypertension, yes. So patient is having hypertension and patient is taking calcium channel blocker medication, CCBs ले रहा है. So दोनों ड्रग इंटरेक्ट करेगी और क्लाइंट को टॉक्सिसिटी का रिस्क बढ़ जाएगा. सो क्लाइंट को टॉक्सिक, अगर आइबोप्रोफेन की टॉक्सिसिटी हो जाएगी सो एनसेड्स के साइड इफेक्ट्स देखने को मिलेंगे, सो टॉक्सिसिटी रिस्क इंक्रीज हो जाएगा. सो यू हैव टू अवॉइड दिस इन सच पेशेंट्स. Okay. Next, non-opioid drug is acetaminophen. Acetaminophen is itself paracetamol. Acetaminophen, commonly known as Tylenol. Yes, you have to remember this word also. Sometimes in examination, they will ask you using this word. The patient is taking Tylenol, this mg and dose, TD or BD or OD, you will be given this information. So there is another word for acetaminophen, that is Tylenol. You have to always remember this word also. Tylenol means
Acetaminophen.
acetaminophen is paracetamol. So you have to remember this word also. Acetaminophen is contraindicated in client with hepatic or renal disease, alcoholism, and hypersensitivity. You have to always remember this. Acetaminophen, we cannot give acetaminophen with hepatic or renal disease client, the person who is alcoholic, and the person has sensitivity, hypersensitivity to the paracetamol. As paracetamol is, acetaminophen कैसी ड्रग है? What is
Analgesic.
analgesics? Yes, it is analgesics, but it affects which organ?
Hepatotoxic.
Hepatic.
Yes, it is
Hepatotoxic.
hepatotoxic. It is highly hepatotoxic. What is the maximum dose you can give to a client?
4 gram
4 gram per
Per day.
day. And if the client is taking acetaminophen for long term regularly, then what is the maximum dose for that client?
3 gram per
3
Gram per
gram.
day. Yes, so you have to remember this dosage. Or says the client for the history of liver dysfunction, because we know acetaminophen is highly hepatotoxic. So we have to always check for the liver dysfunction. If the client is having liver dysfunction, we cannot give acetaminophen to that client. Monitor the client for signs of hepatic damage. You have to also monitor while the client is taking acetaminophen, you have to check the signs for hepatic damage. For example, nausea, vomiting, diarrhea, abdominal pain, jaundice, and sub-lab tests like
SGPT or SGOT.
yes, SGPT, SGOT, that is ALT,
AST.
AST, ALT.
ALT.
These are the liver function tests through which we can identify the liver's function. So we have to monitor such signs. Monitor liver function parameters, that is the liver function test. Tell the client that self-medication should not continue longer than 10 days in an adult or 5 days in a child because of risk of hepatotoxicity. Yes, acetaminophen is over-the-counter drug. We can buy acetaminophen without prescription also, but we have to advise the client that no one can take acetaminophen longer than 10 days because it is hepatotoxic. If the person is taking acetaminophen for more than 10 days, TDS and more than 10 days, the hepatotoxicity risk will increase. And in child, we cannot give acetaminophen for more than
5.
5 days. So you have to remember this also. The antidote for acetaminophen is acetylcysteine. Yes, N-acetylcysteine or acetylcysteine. If the patient has a overdose of acetaminophen, the patient has consumed more acetaminophen, what is the antidote?
Acetylcysteine.
Yes, acetylcysteine is the antidote. You have to remember this also. The main important point with acetaminophen is the major concern with acetaminophen is hepatotoxicity, as acetaminophen is hepatotoxic. Okay, so this is about non-opioid analgesics. Next is opioid analgesics. If the person's pain is not relieved by non-opioid analgesics, you will move towards opioid analgesics. Opioid analgesics are higher dose analgesics. We cannot directly prescribe opioid analgesics to the patient. It is always we have to go for first non-pharmacological method, then non-opioid analgesics, then opioid analgesics. So let's start with opioid analgesics. This medication suppresses pain impulses but can also suppress the respiration and coughing by acting on the respiratory and cough centers located in the medulla of the brainstem. We know opioids are analgesics. It will suppress the pain, but it also suppresses the respiratory centers which are located in the brain. So respiratory centers will get depressed and coughing will also get depressed. Understood?
Yes, ma'am.
Okay. So review the client's history and note that clients with impaired renal or liver function may only be able to tolerate low doses of opioid analgesics. Also assess for allergy. If you are giving, if you, doctor is prescribing opioid analgesics to a patient, we have to always check the renal and liver function because all drugs are metabolized in liver and excreted through kidney. So we have to check renal and liver functions because if the renal and liver functions are impaired, the patient will always will patient can all tolerate only low doses. We cannot give high doses of opioid analgesics because of renal and liver failure. So the patient can only tolerate low doses of opioid analgesics, and we have to also assess for the allergies with the opioids before giving opioid medications. IV route administration produces a faster effect than other routes, but the pain relief effect is shorter. Yes, we know IV medication has a faster effect compared to oral medication, but the effect is for only short period of time. Understood this point?
Yes.
Yes, जब भी हम पेशेंट को आईवी से देंगे मेडिकेशन सो इफेक्ट विल much more faster as compared to oral medication, but the effect will be for only short period of time. Opioids, which produces euphoria and sedation, can cause physical dependence if used for longer period of time. This is something drawback of opioid. Opioid से euphoria होता है, sedation होता है. What is euphoria?
Happy
Excessive
feeling.
happiness.
Happy feeling. So due to this feeling, देयर इज द चांसेस ऑफ फिजिकल डिपेंडेंस। अगर हम किसी पेशेंट में ओपियोइड्स लॉन्ग टर्म से यूज करते हैं तो पेशेंट को उसकी आदत लग जाती है, द पेशेंट कैन यूज अब्यूज द ओपियोइड्स, that is there is one drawback of opioids. Administer the medication 30 to 60 minutes before painful activities such as coughing and deep breathing, ambulation and dressing changes. Yes, you have to remember this point. Whenever a patient is experiencing severe pain or before any painful activities, you are planning to do some activities to the patient. So you have to always give opioid medication before 30 to 60 minutes. Just for example, आपको एग्जाम में ऐसा कोई क्वेश्चन आएगा कि you are caring for a burns patient, किसी को बर्न्स हुआ है और आपको ड्रेसिंग चेंज करना है. So while changing the dressing of burns patient, they will experience so much of pain. So before doing dressing changes, what you will do? So the correct option will be administer opioids before 30 to 60 minutes. You cannot administer opioids immediately before dressing changes. Okay, it will not create any effect. For any painful activities, you have to at least administer opioid medications before 30 to 60 minutes. Understood?
Yes.
Yes,
Okay.
ma'am.
Monitor the respiratory rate. If it is less than 12 bpm in adult, withhold the medication and notify the PSCP. This is the important point. As we know, opioid will depress the
Respiratory.
respiratory
Respiratory.
center, yes. And the patient is already experiencing bradypnea. The respiratory rate is less than 12 bpm. So you have to withhold the medication. You can be asked like this. Okay, the patient is having severe pain and opioid analgesics are already has been prescribed to the patient. And it is the time to give the opioid analgesics. But before giving opioid analgesics, it is our duty to check the respiratory rate first. You are checking a respiratory rate of the patient and it says that the patient's respiratory rate is 10 bpm. So what you will do?
नहीं आपने.
Yes,
So
we cannot administer that medication and we have to notify the PHCP कि सर पेशेंट का रेस्पिरेटरी रेट बहुत कम है, सो आई कैन नॉट गिव ओपियोइड एनाल्जेसिक्स, एंड देन PHCP विल गिव यू ऑर्डर फॉर डूइंग समथिंग एंड देन यू हैव टू फॉलो देयर ऑर्डर्स, बट यू कैन नॉट directly give the medication to the patient. You have to always withhold the drug. Okay, monitor the pulse. Monitor the pulse. If bradycardia develops, withhold the medication and notify the PHCP. Yes, opioid can depress the whole patient. So if patient is experiencing bradycardia less than 60 bpm, so you have to again withhold the medication and you have to notify the PHCP. Monitor for the BP for hypotension and assess before administering pain medication to decrease the risk of adverse effect. Opioid will calm down the patient completely. The respiratory rate will get down, the heart rate will get down, the blood pressure will also get down. So before giving medications, you have to always check blood pressure, respiratory rate and heart rate. If the patient is experiencing hypotension, can you give the medication?
No.
No, we have to withhold. We have to ask the PHCP first. Can I give opioids to patient in this blood pressure? So you have to withhold the drug and you have to contact the PHCP. Auscultate the lungs for normal breath sound. Yes, it depresses the respiratory mechanism or respiratory system in the body. So you have to always auscultate the lungs sound for the normal breathing sounds. Encourage activities such as turning, deep breathing, incentive spirometry to help prevent atelectasis and pneumonia. We know while giving opioids, while giving anesthesia, all this medication will sedate the patient and will create the complications. So to prevent that complication, we have to change the position of the client. We have to teach the client about deep breathing techniques, incentive spirometry. Do you know about incentive spirometry, new students?
Yes, ma'am.
What is that?
The deep breathing means in
Yes, it is a method. There is a device in which there are three balls and patient is asked to inhale deeply so the balls can get up. So we can advise the patient about incentive spirometry. All this will prevent the complication of this medication. And what are the complications? Like atelectasis and pneumonia. What is atelectasis?
collapse.
Yes, the alveolar sac become collapsed. Collapse हो जाएंगे alveolar sac. So to prevent that, we are using these methods to prevent the complications. Okay, monitor the client's level of consciousness because opioids will reduce the level of consciousness. Initiate safety precautions. Why?
હાઇપોટેન્શન ના લીધે પોસ્ચ્યુરલ હાઇપોટેન્શન થાય છે.
Yes, yes,
એટલે
due to
ફોલ
the
પ્રિકોશન રાખવાનું.
fall precaution rakhwana. And second, it also alters the consciousness of patients. So both are the reasons for the safety precautions. Monitor intake and output and assess the client for urine retention. Also, constipation is common with opioid use. All these medications will slow down whole body. You have already seen the patients after surgery. There are risks for urine retention. Why? Because of the opioid effect. द पेशेंट को आप जब जनरल एनेस्थेशिया देते हो तो पेशेंट को यूरिनरी रिटेंशन होने का रिस्क ज्यादा है, कॉन्स्टिपेशन भी हो जाता है. सो दिस इज द रिस्क ऑफ ओपियोइड यूज एंड एनी सिडेटिव मेडिकेशंस. Instruct the client to take oral doses with milk or snack to reduce the gastric irritations. Opioid medications can also cause gastric irritation. So we have to always advise the patient to take these medications with milk or some snacks. Instruct the client to avoid activities that require alertness. We have to advise the patient that you cannot do some activities that require alertness, like driving, uh, then managing some devices, instruments, dangerous instruments, hazardous instruments. The patient cannot do all these activities because the patient is already taking opioid analgesics. So we have to instruct the patient to avoid such activities which require high alertness. Assess the effective of medications 30 minutes after administration. Yes, it is our duty to assess the effectiveness of medication. It is not like that कि आपने पेशेंट को मेडिसिन दे दी फिर आप भूल गए कि अभी पेशेंट को पेन कम हो ही गया होगा. नो, वी हैव टू चेक द इफेक्टिवनेस आफ्टर गिविंग द मेडिकेशन. 30 मिनट्स के बाद आपको फिर से चेक करना पड़ेगा पेशेंट को पेन कम हुआ या नहीं. व्हाट इज द एंटीडोट फॉर ओपियोइड?
Naloxone.
naloxone.
नैलोक्सोन. अगर ओपियोइड ओवरडोज हो जाता है तो आपको कौन सा एंटीडोट देना है? दैट इज द नैलोक्सोन. Again, what you can give to the patient? Oxygen, because it depresses the respiratory centers. So we have to give oxygen. Resuscitation equipment should be readily available. अगर opioid overdose हो जाएगा तो patient can die due to the overdose because completely depressed हो जाएगा, सब कुछ depressed हो जाएगा. Severe bradycardia, severe bradypnea, hypotension, ये सब होने का risk बढ़ जाएगा. So you have to keep readily available the resuscitation equipment. If there is a need for resuscitating the patient, you have the appliances nearby you readily available रखना है आपको. Prescription for opioid analgesics can be given in only very specific circumstances. We know opioid analgesics cannot be prescribed initially. If there is much more need, only then we can give the opioid analgesics prescription. Specific forms regarding the use of opioid analgesics, including the risk assessment tools and informed consent forms, need to be reviewed and signed by the client. We cannot give opioid medications just like simple other prescribed medications. आपको कोई भी क्लाइंट को ओपियोइड मेडिकेशंस देने से पहले उसका फॉर्म फिल करना पड़ता है कि what are the risk factors linked with this medication, and you have to take the consent from client that I am responsible for taking these medications, all that. Prescription monitoring systems may need to be checked prior to a client filing a prescription for controlled substance to ensure that multiple prescriptions for the same medications are not being filed. Yes, before giving prescription, इट इज द ड्यूटी कि आप चेक कर लो कि पेशेंट को डबल डोज ना हो जाए. फॉर एग्जांपल ओपियोइड्स आर कंट्रोल सब्सटेंस. अगर पेशेंट कोई और टाइप ऑफ मेडिकेशंस ले रहा है जिससे कंप्लीटली उसका बॉडी सिस्टम डाउन हो जाएगा, डिप्रेस्ड हो जाएगा, सो और आप ओपियोइड्स दे रहे हो तो बोथ मेडिकेशन विल कंबाइनली डिप्रेस द पेशेंट. Respiratory centers and all will get depressed. So you have to check this prescription that there are any other multiple medications, controlled substances the patient is taking or not. Frequent collaboration between nurse and the PHCP on a continued need for this type of medication should be done. Yes, it is not like that कि आपने patient को opioid का prescription दे दिया फिर आपका काम खत्म हो गया. No, regular collaboration करना पड़ता है nurse, PHCP and pharmacist also. So they can check the medication is patient is taking medications regularly and in a normal way. There are chances of opioid
Overuse.
ओवरयूज और अब्यूज. सो आपको कोलैबोरेटिवली वर्क करना है, नर्स, पीएचसीपी और फार्मासिस्ट को मिलके वर्क करना है टू चेक द पेशेंट इज टेकिंग मेडिकेशंस इन अ नॉर्मल वे. ओवरडोज भी ना हो जाए और अंडरडोज भी ना हो जाए. रेगुलरली नॉर्मल वे में पेशेंट ले रहा है कि मेडिकेशन नहीं, वो आपको तीनों को कोलैबोरेटिवली वर्क करना है. A pain management specialist need to be consulted for complex pain management cases. अगर क्लाइंट को कॉम्प्लेक्स पेन हो रहा है so उसको मैनेज करने के लिए एक स्पेशलिस्ट की रिक्वायरमेंट लगेगी. It cannot be done by PHCP or nurse. The specialist will be needed for managing the complex pain of patients. The important point that you have to remember is an electronic infusion device is always used for continuous or dose demand IV infusion of opioid analgesics. पेशेंट की कोई ऐसे सीवियर कंडीशन है, लाइक फॉर एग्जांपल पेशेंट को सीवियर बर्न्स हो गया है, 3rd degree बर्न्स हो गया है. सो during this time the patient will require continuous infusion of opioid. So can we give continuous infusion of opioids through pint?
No.
No, we cannot administer continuous infusion of opioids through pint. We will always require an infusion pump or infusion device to deliver that opioids through IV. Understood? So you have to remember, जब भी क्लाइंट को कंटिन्यूअस ओपियोइड्स की जरूरत हो तो आप पाइंट से डायरेक्टली नहीं दे सकते, आपको ऑलवेज रिक्वायरमेंट लगेगी इन्फ्यूजन पंप की और अदर इन्फ्यूजन डिवाइसेस की. If the patient is taking opioids orally, then there is no need for infusion device. Or if the patient is on IV medication, but it is not continuous, it is like OD or BD, so you will not require any infusion device. But the patient, if the patient requires continuous dose of opioids, then and then you will require some infusion devices. Understood?
Yes.
Yes, ma'am.
Okay. So let's complete this topic also. Next is adjuvant analgesics. Adjuvant analgesics means what is this? Adjuvant analgesics? Adjuvant. What the word adjuvant mean? Adjuvant means adjacent. उसके साथ साथ. Adjuvant analgesics are types of analgesics which can be given with opioid analgesics to increase the effect of opioid analgesics. So let's see. What is adjuvant analgesics? These medications are used to complement the effect of opioid analgesics. Person opioid analgesics ले रहा है और उसकी असर ज्यादा करने के लिए हम साथ में दूसरे analgesics दे रहे हैं. That is called as
adjuvant analgesic.
yes, adjuvant analgesics. They are especially helpful for neuropathic pain. If the patient is having neuropathic pain, what is that? Neuropathic pain means
કોઈ disease ના કારણે નવ ડેમેજ થાય ને તેના કારણે જે પેન થાય ને.
यस, नर्व पेन हो रहा है क्लाइंट को, सो आप उस टाइम जो देते हो दैट इज न्यूरोपैथिक पेन. The medications that are used as adjuvant analgesics were originally developed to treat other conditions such as depression, seizures or dysrhythmias. जो एडजुवेंट एनाल्जेसिक्स है उसको ओरिजिनली किसके लिए बनाया गया था, तो लाइक डिप्रेशन. वी नो वन टाइप ऑफ डिप्रेशन मेडिकेशन दैट इज यूज्ड फॉर बोथ एज एंटी डिप्रेसेंट एंड एज न्यूरोपैथिक पेन. व्हाट वाज दैट मेडिकेशन? TCA, Apple,
Topology.
sorry, someone is trying to speak. हमने एंटी डिप्रेसेंट्स पढ़ लिया है ऑलरेडी उसमें.
Tricyclic antidepressant.
Yes, tricyclic antidepressants. What is the mechanism of that medication? It relieves the depressions as well as न्यूरोपैथिक पेन, उसके लिए भी हम यूज करते थे. हाँ, सो एडजुवेंट एनाल्जेसिक्स ओरिजिनली किसके लिए डेवलप किया था? टू ट्रीट सम कंडीशंस लाइक डिप्रेशन, सीजर्स, डिसरिथमियास, उसके लिए बनाया गया था. एग्जांपल्स आर एमिट्रिप्टिलिन. एमिट्रिप्टिलिन इज
TCA.
TCA. Teline is also TCA. Venlafaxine, gabapentin. These are some examples of adjuvant analgesics. When the patient is taking opioid analgesics, along with opioid analgesics, you can give these medications to increase the effect of opioid analgesics. Okay. Nursing interventions depend on the medication class, side effect, and considerations for the adjuvant analgesics prescribed. अगर आपने ओपियोइड के साथ साथ एडजुवेंट एनाल्जेसिक्स प्रिस्क्राइब किया है, सो विच नर्सिंग इंटरवेंशंस यू विल कीप इन माइंड? इट डिपेंड्स ऑन द मेडिकेशन क्लास कि वो ड्रग है वो कौन से क्लास की है, उसकी साइड इफेक्ट क्या है, व्हाट नर्सिंग कंसिडरेशन यू हैव टू कीप इन माइंड related to that specific adjuvant analgesics. So the intervention will depend on that. Marijuana and other substances such as CBD may be considered for use of pain management depending on physician preference and its legal status for use. Yes, marijuana, these are called as substances. Other substances that can be used for euphoria and all that. So marijuana and CBD. CBD means it is a kind of cannabis. Have you heard about cannabis? Cannabis can be taken as other substances also. So these are the substances. It can also used for the pain management. These substances will reduce the pain of patient depending on the physician preference and its legal status for use. अगर उस स्टेट में ये लीगल है कि डॉक्टर्स मैरिजुआना यूज कर सकते हैं फॉर pain management of the patient, so they can use. If it is illegal, then it cannot be used for pain management. Understood?
Yes.
So let's do a quick revision of our today's class. So today we have completed conventional non-pharmacological therapy. What are the conventional non-pharmacological therapy? Which therapies were there?
Cold pressure.
Okay, cutaneous stimulation, then TENS, then
Hot and cold pressure.
yes, hot and cold application, and last,
Slings and binder devices use कर.
yes, binders, slings, and other supported devices. All these are conventional non-pharmacological methods through which we can reduce the pain of patient. The important point that you have to remember about heat and cold application is
Barrier should be used and not left more than 50 or 30.
yes, you have to always keep a barrier between the applicator and the skin, and we cannot place the applicator for more than 15 to 30 minutes. Okay, then next is complementary and alternative therapy. What are the complementary and alternative therapies? Which are that?
Biofeedback, acupressure, puncture.
Yes, so there is a list. Acupuncture, acupressure, biofeedback, chiropractic manipulation, distraction technique, guided imagery, herbal therapies, hypnosis, laughter, etc., etc. You have to just remember these names because sometimes they will ask you such a simple questions. From the patient is having some pain or etc. And we have decided to give the complementary therapy to the patient. So which therapy is the complementary therapy? So you have to know, okay, these therapies are called as complementary therapies and we can give this to the patient. Nursing consideration that you have to keep in mind while giving complementary and alternative therapy. Like some therapies will require PHCP's prescription. Herbal remedies are called as pharmacological therapies because it does interact with other medication, prescribed medication. You have to always consider patient's spiritual and cultural practices before implementing that practices into the plan of care. Then we have seen some herbal remedies, their uses and side effects. What is the key point for herbal remedies?
जी
Yes. जो भी मेडिकेशन जी से स्टार्ट होती है उसका साइड इफेक्ट
Bleeding.
bleeding risk.
will be always a bleeding risk because that is the shortcut key that you have to remember. There are other herbal remedies that is provided into the U world. Whenever you will practice the U world questions, you will see this medication chart and you have to take the picture, not by taking screenshot. You will not allow you to taking the screenshot. If you will take the screenshot, the U world login will get disrupted and you cannot log in again. So don't take screenshots from the URL. You can directly take picture through the camera. Then we have seen pharmacological interventions. In that, first we have completed non-opioid analgesics. What are the examples of non-opioid analgesics? Yes, NSAIDs and acetaminophen. We have seen the side effects of NSAIDs and aspirin. Then acetaminophen we have seen. What is the main concern with NSAIDs? NSAIDs.
Bleeding.
Bleeding risk. And what is the main concern with the acetaminophen? Hepatotoxicity. That's the lead point that you have to remember. Then we have completed opioid analgesics. Opioid analgesics are higher dose analgesics and it will require the consent from the patient also. You have to check the patient's heart rate, blood pressure, respiratory rate before giving the medication. If it is in lower range that the patient is suffering from bradypnea, bradycardia or hypotension, you will
Hold the
Stop the
नहीं
medication.
अप्पा नहीं
medication and inform the
hold the
patient.
medication, inform the PHCP. Always remember this point. Before doing any painful procedure or activity, you have to administer opioids. Before how much time?
Before
30 to
30.
60
30
30
to
to
60
60 minutes. You cannot immediately give opioids immediately before the procedure. आप प्रोसीजर ने करने से पहले इमीडिएटली मेडिकेशन देके प्रोसीजर नहीं कर सकते. पेशेंट को कुछ भी इफेक्ट नहीं होगा. You have to always give the medication before 30 to 60 minutes. Okay. Then what is the important point that you have to remember? Red point.
when we give opioid, we use always electronic infusion device.
यस जब पेशेंट को कंटिन्यूअसली ओपियोइड की नीड हो कंटिन्यूअसली ओपियोइड्स चल रहे हो सो वी विल ऑलवेज रिक्वायर सम इन्फ्यूजन डिवाइस लाइक इन्फ्यूजन पंप etc. We will require that. What is the antidote for opioid overdose?
Naloxone.
Naloxone. And what you will require extra other than naloxone in
Prepare
overdose?
ऑक्सीजन
oxygenation
थेरापी
and resuscitation equipment available.
Yes, you have to provide oxygen because of bradypnea. And you have to keep the resuscitation equipments readily available. What is adjuvant analgesics?
Used to
Okay.
इफेक्ट में
complement
इंक्रीज करा
effect with opioid analgesic.
Yes, these are some medications which are used to increase the effect of opioid analgesics. The examples are amitriptyline, venlafaxine, gabapentin. These are some examples. Originally, it was meant to use in conditions like depression, seizures, and dysrhythmias, but they have identified that this medication can also be used with opioid analgesics to increase their effect. So nursing consideration will depend on the type of medication that we are using along with opioid analgesics. Marijuana and other substances like cannabis, CBD can also be used for pain, but there should be a legal authority to use that types of substances in that particular state. Understood?
Yes.
Yes,
Okay.
ma'am.
From tomorrow onwards, we will start the lab values. till now vital signs has completed. See, we have completed all 6 vital signs, and from tomorrow onwards we will see the lab values, different types of laboratory values. We have to all remember the normal range of all the laboratory values. Okay.
Okay,
Okay,
ma'am.
just wait for a minute. Let me take the attendance. Okay, now you can leave. See you tomorrow at 9 a.m. Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank